Hi guys, it's Juana again. So I have this week also. I wanted to thank everyone for having such an awesome discussion this week about workplace violence, and I was really happy that you guys found it as interesting as I do. So thanks for that, and I hope that this week is similar. So I originally wanted to do opiate use among different racial and ethnic groups, but I found a really interesting paper about overdose, and it looked at unintentional versus intentional overdose. So I picked that paper and I wanted to focus on different racial and ethnic categories for that. So the paper that we'll discuss is Mapping Drug Overdose Demographic and Socioeconomic Characteristics in the Community, published in Wisconsin Medical Society's journal. So keep in mind that this study was done in a county in Wisconsin. So probably very different from what we would see in Texas, but I think that their findings are really interesting and really relevant to some of the challenges that we face all over the country. So the full text is available for free online, so I hope you find that, and I'll post a link. So what is the main intent of the authors? I quoted them on page 19. They said they sought to better understand the differences between intentional and unintentional overdoses treated by our health system. And more specifically, they wanted to see how patient-level characteristics like sex, race, and insurance, and population-level characteristics like socioeconomics, education, and neighborhood change the different rates of intentional and unintentional overdoses. So this is something that I wasn't really familiar with, but it's so interesting to think of it on like the ecological level. So you want to look at the patient level, but also the population and neighborhood community level factors that might be impacting these outcomes. So their methods, they looked at the health records from a medical center in that county, and I wanted to talk about some of their findings. So when they looked at just the descriptive data, race and ethnicity, the p value that they found was not significant, but on the patient level predictors, there were significant ones, and those were age, sex, insurance, and drug type. So age and sex are probably not really related to race and ethnicity, but insurance and drug type most likely are, and they actually did find that those were different based on different racial and ethnic categories. And so when they did a multivariate model, they found that non-white patients were 2.7 times more likely to OD unintentionally compared to white patients, and that was actually a significant value. And uninsured patients were 2.5 times more likely to OD unintentionally compared to insured patients, although that was not significant. And then one thing that I found really interesting was that opiates and narcotics and heroin were 3 to 10 times more likely, respectively, to be associated with unintentional OD compared to other drugs. And they looked at benzodiazepines and then sedatives and hypnotics. And those two were actually more associated with intentional overdose. So interesting stuff. And both of those were found to be significant. So, and then the final finding that I wanted to highlight was that neighborhood level predictors of high OD rates were low median income, low income inequality, high non-white population, and high percentage of some college education. So I thought this was so interesting because those first three are probably really highly correlated with each other. So what I was imagining when I was reading this paper is, okay, you have a neighborhood that's low medium income and low income inequalities. So you have a neighborhood where basically everyone is low income. And so those neighborhoods are more likely to have a high rate of OD. And the high non-white population, as we know, racism is present in so many like universal institutions in the US. So things like segregation that still tends to happen nowadays, that would also contribute to why the high non-white population might have high OD rates and might be present in these neighborhoods of just universal low income, unfortunately. So what do the authors conclude from their work? In addition to the findings that I summarized, They found that community level investigation is crucial to understanding local trends in drug use, overdose rates, etc. And then they also highlighted that it's important to look at overarching issues such as insurance, especially looking at categories such as private, government insurance, or uninsurance, because those had different rates of unintentional and intentional overdose depending on what kind of insurance they had. And then they also discussed costs associated with healthcare post overdose. I didn't want to talk too much about that because I think that's really more relevant to Wisconsin as a state, and it probably wouldn't be super relevant to Texas because I'm sure that prices are different in different states. And so, is there enough evidence to support the author's conclusions? I think that their methods were really strong. It seemed very sound to me, so I think in a local context, there was enough evidence to support their conclusions. But I did have some questions, some things that I think were a little bit problematic. I don't think that it was the author's oversight. I think it's just really hard to look at overdose objectively, because I think a lot of overdose cases probably don't end up in the healthcare system, and since they used the hospital's records as their main source of data, they might be failing to capture all of the different overdoses that happen outside of the hospital and just never get treated, never end up in the healthcare system. And then also something else that they talked about was classifying unintentional versus intentional overdoses, because they will classify a case of OD as unintentional unless the patient explicitly says that they were intending to harm themselves through the overdose. So the way I imagined it is a patient who was trying to harm themselves but ended up in the hospital and didn't want to be in the hospital probably wouldn't tell their doctor or their nurse that they were trying to overdose on purpose because they don't want to stay in the hospital any longer than they need to. That's just kind of how I rationalized it. And they also discuss this in the paper, so there's more on that in there. And so the final question that I wanted to discuss were the determinants that might be contributing to the findings in the study. And with this question, I feel like it's always easier to ask myself just a couple of smaller questions to break it down a little bit. So I asked these three. First was, what drives higher rates of unintentional overdose among non-white individuals? What drives high rates of unintentional overdose in low-income communities? And why are uninsured individuals more likely to overdose unintentionally than intentionally? So as we know, there is a rampant amount of institutional racism across the United States, to where people of color might not have access to the same resources that white people do when it comes to managing drug addiction and safely using their drugs. And same for low-income communities. Like I said, there seems to be a lot of, I can't remember, I think redlining was what it was called, that kind of tends to segregate people of color to certain neighborhoods compared to white people. So, and that correlates a lot with low-income communities. So those are very highly related with each other. And then, like I said, why with the uninsurance, if someone who doesn't have insurance, tried to take their own life via overdose, but they failed and they ended up in the hospital, since they don't have insurance, they don't want to be in the hospital any longer than they need to, so they wouldn't admit to their whoever is providing care that the overdose was intentional. And I wanted to learn more just to see what the CDC thinks about it. So I have a few graphics. I wanted to look at how heroin use specifically has changed. And I found this, it's this graphic that shows it's the number of heroin users per 1,000 people in each population category. So if you look at the race and ethnicity chunk here, you'll see that it actually increased for non-Hispanic white people and it decreased for other from this 2-year interval to this 2-year interval. But a lot has changed since 2015 when this was published, so I looked at that as well. And so for Wisconsin specifically, there's been a significant increase in emergency department visits for suspected drug overdose. And this is about all drugs, so it's not just heroin or opioids. And Texas is not a funded state for this specific study, so I didn't have data on that. But I thought all this was really interesting just to see how the different, basically the epidemiology of drug use has changed, and it has changed differently for different racial and ethnic groups. So we'll talk about this more in the discussion, but